Okay, so basically it was a bad batch, and they knew it was a bad batch, but because they couldn't get it replaced, they kept selling it anyway.
Yes, and it was a lot of Botox.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. In this episode, I'm speaking with Paige Savage. She's a physician's assistant here in Seattle, and we work together at Glow Spa. We're sharing some stories from our own experience about people who are practicing medicine illegally and exploring just what outrageous practices like buying fake Botox have become commonplace in the med spa world. We hope that by the time you hear our conversation, you'll understand why this matters to you and what questions to ask before you go. Hi, I'm Dr. Kate D., and I'm here today with Paige Savage. Paige is a physician assistant who works with me at Glow Spa here in Seattle. Paige is originally from Houston, Texas, having graduated with a Bachelor of Science from the University of Houston, and has her master's in physician assistant studies from the University of Texas. Paige, welcome. Thanks for being here.
Hi, thanks for having me.
So today we're going to talk about why you should care that people are cutting corners and practicing medicine illegally. How does that actually affect you? So maybe you've been to one of these places and you like the treatment. Why should it matter that it wasn't legal? We are going to share some of our stories just to show you how pervasive this is and all the illegal things going on that you may not know about and why it actually presents a risk to you and why you should really know. So to back up here just a little bit, I started in this business in 2014. This was after 16 years kind of in the breast cancer world. And in the last 9 years, I've seen the industry just go crazy, just explode. It's grown massively. And there's so much money in it that I think that the reason it's exploding so much, so quickly, is that much of the expansion of the industry is actually happening illegally because everybody's sort of getting into it and they want a piece of the action. And as far as I can tell, there are very few enforcements of the law. So unless somebody is injured, maimed, or killed, really, there are no consequences for all this illegal activity. There are, and it affects people every day. And I think that you're going to want to know about these things before going to any of these places. But really, the enforcement of the law is up to you and up to the individual provider. Basically, it's an honor system. So, Paige, I was kind of hoping you could tell some of the stories that you've experienced before you came to work with us, because you said something really interesting to me the other day, that Glow Spa was the first place you've worked at that was actually doing everything legally.
Yeah, so that's true. Until I worked at Glow, I feel like I saw a lot of things that were happening that really should not have been happening.
You told me about one place you worked at in Texas where an MA was the owner. Is that right? A medical assistant?
Yeah, that's true. So this was a medical assistant and she owned this practice. That was my understanding. And there was a medical director and he worked in pain management. And he lived and worked over an hour away and he was hardly ever actually at the clinic.
So basically, the MA was operating without really any oversight.
That's true.
Okay. And just for everybody's knowledge, medical assistants in some states actually have a training course that they can take. It's pretty minimal. In many states, there is no training course or any kind of certification for medical assistants. So they're on the hierarchy, kind of at the very lowest level of education of any kind of medical provider. So what was going on at that spa?
Yeah, so several different things were going on there. I guess the big thing was that there was really no oversight. The medical director was never there, and there was also product that was being ordered illegally from other countries like Korea and Europe. There wasn't great documentation that was happening, so patients would be seen and things wouldn't be documented.
What about the product? So let's just talk about that real quick. So if you get any of those things here in the US, one, it's kind of expensive. The FDA regulates that. You can't actually purchase any of the products that are FDA approved in the United States from a foreign country. Just the same way, you can't really purchase prescription medications from Europe or from Mexico or Canada legally unless you actually, are in those countries. And so the other thing is that a lot of countries have those kinds of products that are not FDA approved. You can't get them here in America. They're not FDA approved here. So they're completely illegal. Even, you can't even import them. Now, how easy is it to get those? I imagine that this person was just ordering it on the internet.
Yeah, I think that they were very easy to get. I don't think there was a whole lot of struggle to get them.
Yes, and if you go ahead and Google that now, you could probably buy fake Botox from anywhere in the world and have it shipped to your doorstep. Okay, so they were taking illegal products and putting it in people. They were, let's see, what you told me something about noses. They were injecting noses, is that right?
Yeah, so noses were being injected, and that is an area that is definitely higher risk to inject. And it wasn't even myself that was injecting the noses, it was the medical assistant, and at some point an esthetician was also injecting them. And there was really no backup plan if anything happened.
Right. So for those of you who've never had your nose injected with filler, it's a very, very dangerous place to inject. So the nose has a very precarious blood supply. And that's why if you go out in the cold and you get exposure, you can get frostbite. And the most common place frostbite sets in is in the tip of your nose because you just don't get a lot of blood flow there. So injecting filler can compromise the blood flow to the tip of the nose, and you can actually lose your nose. And that's been documented many times with filler. It's a very dangerous place. So here in Seattle, we do not inject noses at Glow Medi Spa, and we refer those patients, the few people who are good candidates for that, to a specialist ENT surgeon who uses ultrasound to guide those injections very, very carefully. And she, at least, if she did have a complication, can take that person to surgery and save their nose if necessary. Hopefully that would not be necessary, but super dangerous place to inject. We don't do it. And here we have kind of basically, very untrained people doing it willy-nilly with illegal filler obtained from foreign countries. Okay, I think you told me another story about how they were paying you. That was a little bit dicey too. Can you tell our audience about that?
Yeah, so the way that I was paid was with paper checks, and I mean, I'm not a tax specialist, but at the end, when I was trying to do my taxes, they were messed up. I can't say exactly in what way.
Did they give you a W-2 for your work?
I had to pressure them to give me a W-2, and eventually I did get it, but it was wrong, and my taxes were just very difficult to file that year. Yeah.
So do you know, were they withholding taxes as they were supposed to do as an employer?
No, I don't believe so.
Okay, so they weren't withholding taxes. They probably were not paying payroll tax. So as a small business owner, I learned about this stuff when I hired employees. But basically, there's a lot of laws around how you pay people. And as an employer, not only do you have to withhold taxes for your employees, but you also have to pay a payroll tax, which is quite expensive. And so it sounds like, we don't know. So we don't know. We're not naming names, but we don't think that they were paying taxes. They were probably committing tax fraud, as far as we can tell. Okay, so here we have this practice where they're cutting corners. They're trying not to pay taxes. They're trying not to pay the price that it costs to get legitimate products. My guess is they probably weren't paying the medical director very much since he wasn't doing much. Mm-hmm. And so that's the risk, really. The risk of going into a place like that, you have no idea. You walk into a place, they're wearing scrubs. They look like they know what they're doing. They're smiling. They might be like the nicest people on earth. But it's very risky to receive those products. And they're not going to tell you that we bought these products illegally from Korea. Okay, that is not likely in their pitch to sell you what they're selling. So I just want to give another story from last year. So I was having dinner with the same ENT surgeon that we send our complicated nose cases to. And she told me this crazy story about one of the spas here in our general area that's owned and run by a RN, so a registered nurse. And in Washington State, that's not legal for an RN to own and run a practice. There was no medical director anywhere near the spa. I think they might have been in the process of getting a medical director, but the bottom line was there wasn't one at the time. And one of the nurses at the spa had a vascular occlusion. So vascular occlusions are a complication of filler that is basically the biggest risk that we have in the med spa. Paige, do you want to describe exactly what happens with a vascular occlusion?
Yeah, so if someone were to have a vascular occlusion from filler, basically what's happening is the filler is getting into a blood vessel, and the tissue that the blood vessel supplies the blood to can wind up dying. And so it can necrose. And if it's not treated immediately, then the tissue can die and you can wind up with permanent scarring.
Yeah. So if vascular occlusion does not keep you up at night as an injector, then you really need another profession, because this is something that we're super anal about and we're very, very careful. This is why we don't throw filler around willy-nilly, because if you block a blood vessel that's feeding part of your body, that part of your body will die. So at the time, what happened is they did not have enough enzyme. So they were using a dissolvable filler like we do, but they didn't have enough of the enzyme to treat this. They used what they had. They didn't have any more. They didn't know what to do. It was still occluded. And literally the business people at the spa called around to doctors all over the West Coast, including my friend, which is why we know this story, trying to get this patient treated. And although, my friend said, oh, sure, I'll see the patient, they did not get back to her for several days. And then, 3 or 4 days later, they called her back saying, are you still willing to see this patient? And I guess they had failed at treating this properly. And all I know is I should have warned you all. I don't know what happened to this person. I don't have a conclusion. I know that the patient never did see my friend here in Seattle. I don't know if she's scarred, or I don't know what happened there. I just know that this was a very risky thing. And if you're going to have filler anywhere, you want to know that, one, it's a dissolvable filler and not a permanent filler where there's just no recourse at all if this happens. But two, that they know what to do with it. They have that enzyme in the fridge for emergencies. Hopefully they have ultrasound like we do at Glow. God forbid you need to use it. And I will say that we have not had an occlusion in 9 years at Glow. I'm now knocking on wood to say that, we have treated one once, and that's a whole other story I'll say for another podcast, where someone gave themselves an occlusion with fake Chinese filler that they bought on the internet and injected themselves, but we'll save that story for another time. Let's go on. So let's go on to the other place you're telling me about in Texas. That one I think was owned by an esthetician.
Yeah. So again, that's my impression that this med spa was owned by an esthetician. There was an MD as the medical director that was a little bit more present than the other place.
And so how were they getting their Botox? How were they sourcing that? Were they illegally importing that from foreign countries, or what did they do?
Yeah, so it was not coming from foreign countries, but it was not, they still weren't obtaining it in the correct way. So the way that they were getting it, the majority of the time, was that they were getting it from other clinics that had purchased the product, and that was so that they could get a cheaper price. So they were sort of sharing,
trying to share an account, even though. So these companies, so Allergan is the company that makes Botox, and Galderma is the company that makes Dysport, and they do kind of volume discounts. So the more you buy, the cheaper the price per unit. And so they've also done their best to prevent group purchasing. So these companies don't like it when you join together with someone else and share that purchase in order to get a cheaper price. So they really won't let you do that. So what some places are doing is they're telling their friend, okay, you buy 50 and then I'll buy, half of them from you. And that way we get a better price. And you'd think, okay, that's a great solution. At least it's real Botox, right? So even though it's not legal for a doctor, say me, it's not legal for me to resell Botox to anybody else, whether they're allowed to buy it or not. So estheticians, first of all, are not allowed to buy Botox, okay? So their medical director would have to buy it, but it's actually illegal to resell it to somebody else. So in any event, what happened there? Why was this a problem? Because it was real Botox. So what was the problem with getting it in this way?
Yeah, so this was right after the pandemic started. And at that time, there were some issues with Botox and
so just we actually experienced that too. There was a time where there was some issue with the manufacturer, and we got a bunch of vials as well where it just didn't work. We never really understood why. But then we could just call Allergan and they replaced it for us.
Yeah, and so what happened in this situation is that because the product was not purchased directly, we weren't able to report that there were any issues. And if we did, they would, say, well, why do you have this Botox that you didn't purchase? And so what happened is that I was aware that this Botox was not working like it was supposed to, and then I was asked to continue to inject it.
Okay, so were people upset? I mean, what happened?
Yeah, so people wound up being very upset. People were coming back, they were complaining that their Botox hadn't kicked in, and we would re-inject them, and sometimes again it wouldn't work. We would often try to switch to Dysport, but ultimately I was asked to continue injecting the Botox, and I wasn't comfortable with it, so I wound up leaving that practice.
Okay, so basically it was a bad batch, and they knew it was a bad batch, but because they couldn't get it replaced, they kept selling it anyway.
Yes, and it was a lot of Botox.
Do you know how many vials it was?
Probably over 100.
100 vials. Okay, so that is, my guess would be, $50,000 worth
a lot of money.
It's a lot of money. So, wow. Okay, that's a lot. Wow. Okay. So sorry, I'll try to get my disbelief in check here. So in summary about that issue is that if people are cutting corners that way and there's a problem, there's no recourse because they've done it illegally. Okay. So I would like to back up to a story that kind of started me down this path of ending up writing a book and starting a podcast, because when I started in 2014, I was pretty naive and I did not know the laws. And I opened my practice and I started, and I was solo. And I knew that as a physician, I could practice medicine. And that's about all I knew. Okay. So about 2 years into my practice, I was introduced to a RN who had been doing aesthetic injecting for 12 years at that time. She had worked for a pretty high-end dermatology practice in Seattle, and she had parted ways with this group. She felt like they weren't paying her enough for the amount of revenue that she was bringing in. And she was introduced to me because she was looking for a place to go, a medical director, or, somewhere to practice. She had a non-compete that was 5 miles, and I was just outside that radius. So it was legal for her to come work for me. And I did not know the laws at that time, but I thought, great, it'd be great to have somebody who had all that experience. And so she worked for me for about a year until I went to my very first AM Spa meeting, the very first meeting of the American Medical Spa Association happened that year. And I went to that, and part of the association, they really like to educate people on what are the laws around med spas and encouraging people to be legally compliant. So I learned a lot at that meeting. It was really scary. I learned that an RN is not legally allowed to perform a good faith exam, which is the exam that happens when you first go to see a new doctor, a new clinic. Somebody has to do an exam on you and take a history and figure out what the issues are and do a treatment plan. Well, RNs are not legally allowed to do that. They cannot make a treatment plan, they can't make medical decisions, and they can't prescribe medications of any kind, least of all Botox. So RNs are educated to carry out doctor's orders. They're not allowed to create their own orders. So I learned this at this meeting, and I had no idea. And I sat there in these lectures thinking, oh my God, I'm not legally compliant. This is really bad. I got to go back and fix this. And when I got back to Seattle, I had a meeting with my RN, and she was indignant that I would bring this up. She was like, I've been doing this longer than you. I did this for the dermatologists. I know what I'm doing. You can't, change this. And I'm like, well, it probably was not legal when she was doing it for the dermatologist either. I mean, it's one thing if you already have a dermatologist and you love your derm and you say, you know what, I think I want some Botox. And the dermatologist says, oh yeah, my RN does that. That'd be great. Go see her and get some Botox. That's legal because you already have a doctor-patient relationship with your doctor, and they are saying, yes, you need Botox, and they're delegating that to their nurse. That's legal. But if you're a brand new person and you look up, this RN says, oh, this RN is this snazzy injector, I want to go see her. And she does an assessment and says, oh yeah, sure, you need Botox. I'll go ahead and do Botox. That's not legal. And that's actually not legal, as far as I know, anywhere in the country. But because this nurse had been doing this for a really long time, she felt really put off at my request. And I had not been doing it. I'd been doing it at that point for 3 years or so, and maybe 4. And I was just not willing to break the law. I was like, well, this is my license. If anything happens, I will lose my license, not you. So we ended up parting ways. It was quite painful, actually. And I realized that, there are a lot of people who know the law and don't care. And they're going to do what they're going to do anyway. And she actually went up and set up her own little med spa. And she, at the time, got a friend who is a nurse practitioner to be her medical director. But now on her website, she actually lists currently a gastroenterologist at the university here, who, as far as I can tell, is probably retired. This person's maybe around 70 years old. I can almost guarantee this person doesn't know anything about aesthetic medicine. But anyway, that's who she is practicing under now. So why again is this a problem? This person's an experienced injector. what's the big deal? I will say that while she worked for me, there were a couple of complications that she had where I had to take care of the patient. One person had a complication from a deep peel that she did. Another person had a complication from a IPL treatment that she did. So these are not, just because you're experienced doesn't mean you're going to be perfect. And I don't know. I just think it's really problematic. So what does it mean to practice within the scope of your license? Do you want to describe what the scope of your license is and what the rules are around being a PA?
Yeah, so as a physician assistant, I have to have a supervising physician, and I'm not allowed to practice independently. So you're my supervising physician at Glow. I am able to see patients and come up with treatment plans, but you have to be present.
Yeah. So, and actually, I don't have to be in the spa
No.
while you're doing things, but I have to be
Available.
overseeing and available. Yeah. And we work together and we collaborate and we check in about all kinds of things, like what we want to do in our practice, what kinds of services we want to introduce. We'll share in our practice, we have 2 PAs, 1 nurse practitioner and 1 MD. And we talk all the time about cases and what would be the best treatment. It's great to have people to collaborate with. And then, of course, to deal with any complications, God forbid, that they happen, we're a team and we help each other out with that as well. So legally, in order to practice medicine within the scope of your license, it means you're obeying the laws that say you have oversight and collaboration. Nurse practitioners have similar laws. It's actually quite different for nurse practitioners. They have more states where they can practice independently than PAs. I believe there's 5 states in America where PAs can practice independently. But there are also separate laws about who can own a medical practice. And I'm not going to get into that today, but that's a whole other category of law that people are violating, is who can own a medical practice. But we'll get into that in another episode. So let's see. Let's move on to another story from one other place that you worked. Do you want to describe what was going on there?
Yeah, so this was another office that I worked at, but this was actually here in the greater Seattle area. And at this office, there were estheticians that were actually doing the consult. So they were seeing new patients and deciding what the best treatment was for those patients. And not only that, but there were products that were coming again from other countries. We were getting threads, like dermal threads from, I'm actually not 100% sure, but I believe that they were from China.
So they were ordering supplies from Alibaba?
Yes.
Okay, so for those of you who don't know, Alibaba is kind of like the Chinese Amazon. Like you can basically order anything on Alibaba. Okay, so they were getting threads. Threads are permanent implants, basically, that are supposed to lift the skin. So that's a little scary that they're getting threads from there. What were they getting other stuff too from Alibaba?
Yeah, they were getting cannulas. Cannulas are similar to needles, something that we use to inject filler, and sometimes other things like Sculptra. And there were also some devices that were being used that were not like FDA approved or FDA cleared, like microneedling pens.
What kind of microneedling pen did they have?
Dr. Pen. And
Dr. Pen?
Mm-hmm, I believe you can order that off Amazon.
Okay, that one's actually not one I know about. There are several FDA approved microneedling pens. We have one that's called Rejuva Pen. There's one called Skin Pen. There's a few others, but Dr. Pen is one of those you can just order off Amazon. Okay. Interesting. So as far as you know, were there any complications using those threads, or those were okay? Like they were just cheap threads?
They just didn't work very well.
Okay.
Yeah, they didn't work very well. I have had trainings before where I have used real threads. I've seen real threads being used, threads that the quality is verifiable. But yeah, these threads just didn't perform very well.
Interesting. Would people come back for more then, or you just put them in and then they say, "Oh, I didn't like that"? Or
Yeah, to be honest, they weren't super commonly used.
okay.
And I think that may have partly been because the providers didn't love them, but they still were being used occasionally.
So interestingly, for me, I don't do threads. I don't like threads. I don't think they really play a role. Their complication rate's just too high. So for those of you at home who've never heard of threads, so these are absorbable, long, like they look like suture material. A lot of them have little barbs in that so that when you stick it in the skin, you can pull it and it kind of catches the skin and allows you to kind of tug it up and lift the skin with these barbed threads. Not all of them are barbed, but the reason I don't like them is that there's a very high complication rate. They can get infected, they can be lumpy, they can tug the skin in a weird way so your skin looks like someone like stuck a stitch in it and it looks really odd. So, and then once you put it in, it's a little hard to get out. Sometimes you just can't get it out. It's stuck in there. And you can't really dissolve them. So I just feel like they're just way too complicated, way too many problems for what they do. So I don't like them. I'm not saying they're terrible, like universally, but I don't think that they play a role, at least not in anything I want to do. So, but interestingly, this was a legitimate practice owned by a physician, run by a physician, but they were cutting corners, buying products and materials from China, from ordering off Alibaba. They were allowing RNs and estheticians, it sounds like, to see new patients and make medical decisions. It's a little weird because if you're a physician, why are you asking for problems like that? Like, I don't know. So at least in our state and in pretty much every state, if you have a physician assistant or nurse practitioner, they can do the new patient consultation and they can do the assessment. It's just that not legally, an RN or an esthetician can't legally do that. So if you do have a PA or an NP or a few of them in your practice, why would you have the people who are not allowed to do that doing that? That doesn't make a lot of sense to me, but okay. So here's another, I just wanted to tell this one. We're going to tell one more story here from our own experience. So when I first started in 2000, let's see, it was 2015, I think that this happened. I was looking at a device that was called UltraShape, which was not a device I ended up buying because I thought it was terrible. But anyway, the demo of this device was at this spa here in the Pacific Northwest, and I went to go see it in action. And that spa at the time was owned by an esthetician who since then, she did go to nursing school and became an RN injector. But she's had a rotating door of medical directors over the last decade. Recently, I know she had a nurse practitioner as a medical director, although that person's not currently listed on her website. There's no medical director listed actually on her website. She's the only medical person actually listed. The rest are massage therapists and estheticians. So I met her at this demo. She's a really nice person. An esthetician performed the procedure. There was no medical director at the time. And then a couple years later, I interviewed a nurse practitioner for my place who told me that she had worked at that same spa for a year being their medical director. They paid her monthly. She never went there. She did not practice aesthetic medicine at all. But they were using her license to practice. So that's what happens is if it's not legal for you, you need a license number in order to buy the Botox, in order to buy the lasers, in order to get any of these medical supplies. So a little over a year later, this particular NP tried to set up her own Allergan account to buy Botox. And Allergan told her, oh, you already have an account. And it turns out they were still, the same spa was still using her license to buy Botox because they had never found another medical director over a year later. So, and she had no idea. So in this interview, this is a job interview, and I told her, I was like, you realize that was your liability. Like if anything bad had happened, that you could lose your license. And this nurse practitioner had no idea that was the case. She did not know the liability she was taking on at all. So interestingly, the going rate for a medical director out there is as low as $500 a month. So for $500 a month, you can rent somebody else's license and practice medicine illegally. And I will just tell you, this is rampant. I am privy to a group of people, providers in the industry who routinely will advertise basically, hey, looking for a medical director. And they find like these people on Facebook and they just pay them money and rent their license. So when you go to a place like this, you're engaging in a doctor-patient relationship with the medical director, not the nurse that you just saw, right? And if you walk into a place and you never see a doctor or a nurse practitioner or a PA, and you only see an esthetician or an RN or an MA, that is just not legal, okay? And you really are taking the risk that they are getting supplies, filler, Botox from abroad, or fake Botox, fake supplies. I mean, it's not without risk. So, is there anything else that you'd like to leave our audience with? Hopefully you're happy with your job now.
Yeah, no, it's great. Like you said, that I said earlier, I think that this is the first place that I have worked that seems to do everything by the book, the way that it's supposed to be. Yeah, I guess just for patients, if you're trying to find a provider, if you can do a little bit of research just to make sure that, at least to the best of your knowledge, everything is being done legally, then I think you'll be better off as a patient.
Yeah, as a patient, I would say ask who you're seeing for your consultation. Make sure it's either a doctor or a nurse practitioner or a PA. And then ask the questions. If they have a medical director, who is it? Are they there? Can you make your appointment with the medical director? If the place lists a medical director on their website, but that person's not bookable ever for anything, then run in the other direction, because that means that medical director is never there. Anyway, this has been really great. Thank you so much for coming and talking about this topic. I really appreciate you, and I so appreciate having you as part of my team at Glow. It's been great talking with you.
Oh, well, thank you so much.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspaamayhem.com. I hope you've learned something from our conversation today. If you've had an experience with fake Botox or other products that you'd like to share, please send a voice memo to info@drkatedee.com or submit an email on our website. That's drkatedee.com. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you are listening, and we hope you have learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024, available everywhere books are sold. You can pre-order now on Amazon and Barnes & Noble, and soon on bookshop.org. Links and more can be found on medspamayhem.com.